What you need to know prior to Rezum for benign prostatic hyperplasia, or BPH. First, let's talk about what is BPH. BPH, or benign prostatic hyperplasia, describes a non-cancerous growth of the prostate that can cause blockage of the urinary tract. This blockage results in changes of urinary symptoms such as frequent urination, urgent urination, a slow stream, and incomplete bladder emptying. Minimally invasive therapies are procedures done through telescopes or catheters to vaporize tissue or scrape tissue out in order to create a larger passage for urine to flow through. The Rezum procedure delivers radiofrequency generated thermal therapy in the form of water vapor directly to the extra prostate tissue, causing it to shrink over time. Another procedure called urolift uses tiny implants to hold the prostate lobes apart, like open curtains on a window, to relieve the compression on the urethra. Green light laser PVP, photoselective vaporization of the prostate, uses a laser fiber to vaporize tissue. Another procedure called TURP, transurethral resection of the prostate, uses an instrument that scrapes the tissue out to widen the channel. Transurethral microwave thermotherapy, or TUMT, uses a catheter to heat the prostate, causing it to shrink over time. What are the indications for minimally invasive procedures? Urinary symptoms that are not adequately controlled with medicine alone. So these minimally invasive procedures are an alternative to long-term medication use. Patients that have urinary retention or are unable to urinate or empty the bladder need to consider these surgeries. Recurrent urinary tract infection related to an enlarged prostate, or recurrent blood in the urine related to BPH. Rezum is a transurethral needle ablation procedure to treat benign prostatic hyperplasia that can be performed in a clinic or an outpatient setting. This technology delivers radiofrequency generated thermal therapy in the form of water vapor directly to the extra prostate tissue, and this causes the tissue to shrink and thereby improve symptoms such as frequency, urgency, flow, stream, and straining, as well as getting up at night to urinate. The radiofrequency energy transferred by the water damages the cells, causing the cells to shrink and die. Over time, your body will absorb the treated tissue through its natural healing response. There are many benefits of Rezum. It's a great potential alternative to long-term BPH medications. Rezum relieves symptoms safely and effectively. It provides noticeable symptom improvement within 2 weeks. It's a relatively simple in-office or outpatient procedure, which does not require general anesthesia. Rezum preserves sexual and urinary function and allows patients to return to regular activities within just a few days. The Rezum system uses sterile water vapor or steam to shrink BPH by delivering targeted controlled doses of stored thermal energy directly to the region of the prostate gland with the obstructive tissue, which is causing the blockage. A narrow device similar in shape and size to a cystoscope is inserted transurethral under direct visualization and positioned within the prostatic urethra. Most of the side effects with Rezum may only last a short period of time and are very self-limited. Potential risks, although unlikely, can include infection, bleeding, scar tissue, reduced ejaculatory volume, or other sexual side effects, or failure to improve urinary symptoms. Temporary urinary retention may require the use of a catheter or the need to perform intermittent catheterization for a few days. After the treatment, almost all patients go home the same day, and some go home without a catheter. There is minimal downtime post-treatment, and many patients experience symptom relief in as soon as 2 weeks. Patients may experience some urinary discomfort during the recovery period. The most common side effects include light blood in the urine, some pain or discomfort with urinating, increased frequency or urgency to urinate, discomfort in the pelvis, which typically resolves within 2 to 4 weeks after the procedure. Your doctor will discuss with you how quickly you can return to normal physical activities. Because the procedure may be done under anesthesia, you might need to fast starting the night before the procedure. Certain medications, such as blood thinners, may need to be held several days before. A pre-op exam, including blood work and an EKG, is usually required, and will need to be done by your primary care physician. You will need a ride home from the procedure and a responsible adult available for the first night afterwards. Your doctor will tell you if you require anesthesia or whether this can be done under local anesthesia. The procedure may be performed in the doctor's office or surgical center. These are usually conveniently located in close proximity to where you live. They're specifically designed for outpatient procedures. Some patients may need their procedure performed in a hospital due to medical conditions. With the procedure, the patient is brought into the procedure room and placed on the table. You'll be placed in a lithotomy position, and a local anesthetic will be administered into the urinary channel or urethra. If you're receiving anesthesia, it will be administered by a board-certified anesthesiologist. Once the anesthetic has been placed, a small telescope will be passed gently into the urethra and into the area of the prostate. Radio frequency power from the system generator is applied, which heats up upon contact with the tissue. The vapor immediately enters the prostate cells, causing them to die. Over time, the prostate tissue is absorbed by the body, and this reduces the compression on the urethra and enables an improved flow of urine. A catheter might be placed for a few days after the procedure to help prevent urinary retention due to postoperative swelling. You may notice blood in your urine for up to 6 weeks following the procedure, but if there are worsening blood clots or difficulty urinating, you need to contact your doctor. Irritating symptoms like the constant need to urinate, intermittent burning, or urinary frequency can last for several weeks to months, depending on the healing process and the size of your prostate. When you are discharged, your physician may prescribe an antibiotic to take for a few days, medications to help with burning and discomfort, as well as a stool softener. Please call your doctor if you have a fever greater than 101.5, chills, if you experience a significant amount of blood in the urine or clots that cause lightheadedness or dizziness, the inability or difficulty to urinate, nausea or vomiting, or severe pain. The pre-authorization process is essential. We will communicate with your insurance company to determine your coverage and any co-payments or deductibles that you might owe. We will provide you with an estimate of any charges that you might incur, and these are all due prior to the procedure. Payment plans can be arranged as well. A surgical scheduler will give you a call to set up a date. You may need medical clearance with your primary care physician or internist, including a history and physical exams. Additional testing might include blood work, an EKG, or chest x-ray. You will receive a letter with all of this information and where and when to report for surgery. If you are receiving anesthesia, you should not eat or drink after midnight. Our nurse will call and discuss medications to take in the morning prior to surgery. If you're taking a blood thinner like aspirin, Plavix, Coumadin, Xarelto, or Eliquis, please let your surgeon know, as special precautions may need to be taken. Please remember, never stop these medicines without a discussion with your primary care physician first. Please arrive early to surgery, at least 1 hour before your scheduled surgery time. If you are receiving anesthesia, make sure that you have a ride home. That person must come and stay in the waiting area the entire time of the procedure. We hope that your procedure goes well and that you have a speedy recovery. We appreciate your feedback regarding your procedure, as we are always trying to improve the care that we provide to our patients. Should you have any questions regarding your procedure or recovery, please contact your doctor. Thank you.